I'm really excited that this is the closing conversation today. We've heard from so many diverse constituents in the healthcare sector. Now is an opportunity to hear from some of the leading minds as to where they're placing their bets from an investment perspective. This afternoon's panelists are in pursuit of paradigm-shifting innovations at the intersection of healthcare and technology, and they're all working to pioneer a more transparent, a more efficient, and a more connected healthcare industry, and do so with the ambitious goals of achieving a much more patient-centric system, but also achieving better outcomes from everybody. And as we all know, we're not quite sure how so many of these opportunities are going to work out, but they are huge opportunities for entrepreneurs and forward-thinking thinkers to achieve the ambitious goals that we'll hear about today. So today I'm going to be speaking with some of the world's leading investors in healthcare who will tell us how things like changing incentives, big data, and new technology are transforming the industry as we know it, and more importantly, where they are putting their money right now. So gentlemen, thank you so much for joining us today. I want to start the conversation around the topic of telehealth because in many ways it exemplifies a lot of the themes today that we've been talking about, both the opportunities and the challenges in this sector. And I want to start with it also because each of you have made really big bets in this space, representing three of the largest telehealth companies in the market today. And each one of you also is working with a company that all have very, very different models, but are showing how big the market opportunity is and how exciting and dynamic it is today. So Bob, I want to start with you because in many respects, telehealth is not that innovative, right? It's been over a generation that we've been able, thanks to video conferencing, to connect with individuals, theoretically connect with doctors, often in rural areas, to have the type of care often on very, very common medical issues. But now we're seeing it accelerate in a meaningful way and transform. So give us a sense of the landscape today and why you see it as such an interesting opportunity, both in terms of growth, but also speak on some of the challenges as you've navigated this sector.
Sure. Well, first I'd observe that the term telehealth implies a telephone. And it makes me think of dinner time and somebody calling me to remind me to do something, and it kind of irritates me, the basic premise of telephone health. And I think that's why people didn't get it and buy it and understand it for years, is that the experience wasn't great. And for the last 5 years, with the ubiquity of broadband mobile phones and really high-quality, low-cost video calls, you can actually talk to a face that is a doctor and do it anytime, anywhere. And lo and behold, if you do that at home without going to the office, it saves you a bunch of time, and it saves a lot of overhead for the doctor. So you can do it a lot more cheaply. And so when you put that together, what you end up with is a way better product experience, which is access to a doctor to help you with a problem, maybe prescribe a medication for $30, $40, $50 right now, and you solve your problem. And in fact, as a doctor, I can say, many of the visits that I do with patients would take me 5 or 7 or 10 minutes. You don't need an hour to figure out that conjunctivitis needs erythromycin ointment. And so you can do a lot of this over the phone, and so patients can get healthcare faster, cheaper, better at home, and get their problems solved. And the products now really can do that. Because it's a doctor, they can see you, they can prescribe, and they can solve a lot of problems for you. And with modern phones and decent queuing theory, you can have low wait times and high satisfaction. So once patients try this, they're convinced that this is a better way to do it. And we're beginning to have that happen. We're beginning to see the market take off. But it's driven by both the technology being possible and then the fact that most Americans have the first $2,000, $3,000 of their spending that they're on the hook for. And so $185 to see me in my old office or $40 to see a doctor who's also a US-trained, board-certified doctor on the phone is a pretty good deal, not to mention the fact that it's a better experience. So I think for those reasons, we're seeing it take off, and we're seeing it, patients who've used them want to use them again.
So once they use it, they're eager to continue. Is it hard, though, to get that first initial step?
Yeah, you've never done it. You tell somebody, trust me, push this button on your phone, a doctor will pop on the screen, and they will be good, and they can solve your problem, and you can get your healthcare taken care of. People, until you've done it, often don't understand that can happen. And they worry, too, that they might upset their traditional doctor who may not be aware that they're cheating on them to go outside. They might be concerned that they can't prescribe. They don't realize how it works. You have to show them. And so I think we're beginning to have enough people who have done it that they've told their friends that we're going to see it take off.
Brendan, you've talked about the challenges in some ways as a VC in this sector because you said healthcare in America is sadly mostly a command economy. You can, as a VC, have two options. You said study the regulatory and reimbursement trends and build companies that optimize around that rule book, or study the healthcare landscape for chinks in the armor where disruptive technology can come in and start to overcome some of the regulatory barriers that so often prevail. So in light of this perspective, how does telehealth fit in? And can there be, in light of, again, what you've just said, can there be an Uber in healthcare? Is telehealth that?
So I said that. And because I believe that, I probably take a slightly higher level, not disagreeing with Bob, but sort of a higher level explanation for the sort of the late recent emergence of telemedicine. And I will say, I mean, telemedicine does have, and again, I agree with you, it's in some ways not a helpful word, but there's a certain obviousness about it, right? Like, why not pick up the phone and talk to caregivers to resolve issues versus making an office visit? But I would submit that the main reason we're seeing telemedicine take off today is because of structural elements in the healthcare economy, which for the first time create a favorable environment for this particular green sprout of market reaction to grow through the expansion joints in the concrete landscape of the healthcare economy. And what I mean by that is for years when you talk to a doctor and said, why can't I call you and discuss my problem? He'd say, well, I don't get paid by that. I don't get paid by Medicare for that, and I don't get paid by United at Humana Cigna for that. End of story. Come in and see me, because as soon as you walk in the door, then I can charge $90 for the visit. Well, today, courtesy of high deductible plans, and we might hope for a more enlightened payer-provider risk-based landscape, we see an economic incentive to eliminate that office visit and resolve a problem if we can remotely. So I would say we need to start first with that macro view.
So you mentioned some of the structural challenges, and Bob, you talked, you alluded to also the technology is getting better, but from a technology perspective, in many respects, healthcare has been so slow to adopt these types of digital innovations. It's lagged behind so many other industries, and it's such a common frustration, I think, that we hear a lot, that so many seemingly great technologies fail to penetrate the system. John, why do you think healthcare has missed out on so many of these major revolutions that you've had a front row seat to? And how does telehealth represent maybe some of the opportunities and optimism that's changing? But also, what are the challenges, especially for you as an investor, that still exist given those dynamics?
Well, I think that healthcare has been slow to think about the problem in terms of what's in it for the customer. In this case, what's in it for the patient. And let me give you some context, Moira. There was a survey done on what is the typical wait time for a primary care physician for an in-person visit state by state. In 49 of the 50 states, the average wait time is pretty consistent. It's 20 days, except for one state. That one state is Massachusetts, and its typical wait time is 47 days.
Thank you, Governor Romney.
So what's different in Massachusetts from the other 49 states? And is there a canary in the mine shaft with Romney Care that gives us some indication of what we might expect with Obamacare? And the reality is that we have fewer and fewer primary care physicians. They're either dropping out or they are being consolidated up by the hospitals. And we have more and more people who are being added to the insurance rolls. So as I think about the telehealth opportunity, I go back 2 years ago when we were offering to our customers an experience that went something like this. You go to Orlando to one of the big entertainment parks. You have 3 children. One of them gets an earache. It's 8 o'clock at night. What do you do? And we had a solution for that. And we had very happy customers because we said we can deliver a primary care physician that is fully certified to you. And if that physician believes that you need a script for a medication, they can write you that script and you can pick it up at a pharmacy near you. And people love that. And the promise was we would deliver a doctor in less than 60 minutes. Well, that was 2 years ago. And today, if we delivered a doctor in 60 minutes, we'd have a high disappointment rate with customers because they expect to get a primary care physician in less than 10 minutes. We now realize that even 10 minutes is too long. We need to be able to deliver a primary care physician, we think, in about 2 minutes. Well, it's not about technology to do that. It's all about how do you get the right training, how do you get the right protocols, how do you triage a patient to know that they shouldn't be directed to a doctor for an in-person visit or send them to the emergency room. So being able to not only get a great customer experience, it's not just about technology, but it's about how do you scale that so that you get from 20,000 virtual visits a year to 200,000 virtual visits a year to 2 million to a much larger number. And the hardest part for us in our telehealth business, MD Live, has not been the technology. The technology, we're benefiting from all the technology that's going on in things that have nothing to do with healthcare. But it has to do with how do we get a rigor in place? How do we get the protocols? How do we get the doctors trained so there's a consistent customer experience? And we measure ourselves in what, from my world, the consumer world, is called Net Promoter Score. Net Promoter Score is you take on a 10-point scale, you ask people, would you recommend this product or service to a family member or a friend? And if you are 9 or 10, which is good, then we consolidate those numbers. If you are 6 and below, we consolidate those numbers, and then we subtract the 6 and below from the 9 and 10, and that's called your Net Promoter Score. And two of the highest examples of Net Promoter Scores are Apple and Amazon. They're both over 60. We're at 62 with MD Live, but our challenge is how do we keep that up as we scale? Because there's an Uber in here somewhere. It's not a shootout between Doctors on Demand, Teledoc, and MD Live. It's a huge industry. You know, it's a big problem that needs to be solved. There's plenty of room for more than one leader in the industry. But there's an Uber in here only if we can get a customer experience that is so appealing that people will keep coming back again and again. And if you think back 20 years ago with electronic banking, and remember that was a regulated industry too, people said, well, can I really trust doing my banking over the internet? Maybe you can't, but we all do it. And the same thing is happening with healthcare. We're learning how to be HIPAA compliant, how to deal with security issues, how to deal with regulatory issues, how to deal with the reality that every state is different. Some states haven't approved it yet, like Arkansas and Oklahoma, but the handwriting's on the wall. This is going to be an industry where there will be an Uber. You know, whether it's one of the three of us, you know, I don't know. But what I do know is that telehealth, telemedicine, however you want to describe it, is one of these fundamental shifts in the era of the consumerization of healthcare. And this is about as big an industry opportunity as I've seen.
It also makes sense both in, for patients who have high deductibles,
Yeah.
but also as doctors move to risk and they want to find lower cost ways to care for patients, the supply side will want to use it too. And so it works kind of in today and the future, which is one of the appealing things about
absolutely.
it.
There's absolutely the sense, too, that kind of the technology has come of age, and I agree with Bob when he says that, it's an oversimplification to assume that these encounters are purely telephonic. Texting is next.
Yeah.
My son, who plays rugby or played rugby for your auspicious alma mater, broke his shoulder last year, and when he was referred ultimately to a very prestigious orthopedic hospital, whose name I won't mention, I was pretty amazed that his, not his attending surgeon, but his resident felt very free to text back and forth, including pictures of the incision site and so forth. Well, that's major HIPAA violations. Sins of omission and commission going on there. Sins of commission are, that's not a HIPAA-compliant interaction. But the sin, to your point earlier about continuum of care, the sin of omission is that's valuable, interesting clinical data that ought to be part of the medical record and so on. And all three of our companies, I think, are grappling with that issue of how do you integrate with a patient, using the telemedicine example, how do you cycle back with their circle of caregivers in a way that makes this, instead of just an augmented episode island of care, part of the continuum of care that accomplishes the goals we've been talking about all day long.
Yeah, well, one thing, when we started out MD Live, we focused initially on a transaction for low acuity care, relatively simple type of procedures. But over time, we've started to expand into higher acuity care. So we recently acquired a behavioral health company with about 5 million lives called Breakthrough. We're moving into second opinion. We've been building out a network of hospital systems across the US. When I was in the soft drink industry, we had regional territories for franchise bottlers, and it was great having people who were focused on that geography and brought a very different asset to the ecosystem of selling soft drinks, whether it was Pepsi or Coke. We see the similar opportunity in telehealth to be able to deal with even chronic care patient issues like what do you do about the readmit of chronic care patients 30 days after they are been discharged, and if they're readmitted, the hospital and the payer are on the line. So there are lots of areas. While telehealth may have started with low acuity care, it's going to be huge, but that by itself is the basis for a very successful company. We're equally interested in moving up the value chain into higher acuity care and thinking about healthcare from a consumer standpoint as an integrated health delivery system, where you've got to be able to connect different domains. So it can be the domain of pharmacies, it can be the domain of hospitals, it can be the domain of primary care physicians or other specialists. Like derm is an obvious one for telehealth, because you can really interpret a procedure for dermatology very nicely over a smartphone.
Each of you have sort of touched on some of the regulatory changes, reimbursement changes that have been accelerators for telehealth, and obviously that applies to many other innovations. Bob, I want to talk to you a little bit about the Affordable Care Act and what's going on from a policy perspective. You have
Bob, in case you didn't read the notes, wrote the Affordable Care Act.
Yeah. Or either thank or blame you. No, I'm kidding. But you have a very unique perspective. You are on the front lines of this. You helped shape the Affordable Care Act, and in many cases, this has helped accelerate some of the growth in telehealth. But at the same time, there's still huge uncertainty from a political landscape perspective. There's still uncertainty with Obama, the Affordable Health Care Act, with Republican Congress coming up and the like. How, as an investor, do you make decisions when there's so many pieces that are still in flux, when you have all that uncertainty? And how dependent are your future investments on healthcare essentially surviving in the context that we know it?
Sure. So I worked at the White House during the Affordable Care Act. I did not draft the legislation, which is.
And as we know, the White House had actually very little impact.
Well, the Supreme Court's going to.
It's really sort of a bit player in the whole.
Supreme Court's going to have fun on the who wrote what when and where's the comma coming up.
So who edited that? That's the question.
That's the problem, right?
There wasn't copy editor. Is that bastard? Where is he?
Yeah, we needed better editors. That was the only problem. As an investor, the way we approach our investing is with the observation that American healthcare costs a ton. And no matter who's in charge in Washington, we can't, as a country, have it continue to crowd out the rest of GDP. And so whether or not there's the Affordable Care Act, there will be fundamental policy designed to control the rate at which Medicare and Medicaid spending grows so that we can spend money on other stuff in the economy. And so we look for investments where there is economic value created coming out of the trillion-ish dollars of excessive spending a year. And so when we look at a business plan, we want to make sure that it's liberating productivity and cash out of an inefficient system. And if it does that, we think it's going to do well no matter what the political environment might be, because we have to, as a country, become more productive in how we consume our healthcare dollars. We also look for companies where the experience of working with that healthcare company is consumer-like and better, because they're also going to stay, because patients who are getting better experiences are going to keep those things too. And so those are the types of things that we orient towards, because we believe that from a policy perspective, that for the foreseeable future, it's going to be cost will be the driving theme behind whatever happens. And so with the Affordable Care Act, that will be the thing that we need companies to go attack.
I remember in 1990, I guess I was a first-year MBA student at Wharton, and I remember seeing a chart that in a healthcare economics class that said that by 2020, it will require a 50% payroll deduction to support Medicare as currently configured based on benefit design and actuarial results and so forth. And lo and behold, we're sort of, we were on that course. And my reaction to the question is, no tree grows to the sky. The trend lines that were in place, even without the Affordable Care Act, were utterly unsustainable. It couldn't happen. So things need to change, and they are changing. I don't know that the Affordable Care Act necessarily intended to elevate the amount of out-of-pocket expenditures for all Americans, courtesy of high deductibles per se, but that, whether it existed or not, that was gonna happen. And when it did, guys like John, who are black belts in the consumer economy, are really gonna come into their own with respect to what that means for providers and how they act and behave. So I'm with you. You're looking at these really big trends in this $3 trillion chunk of the economy and saying, what are the waves that are immutable and unstoppable?
One of the things that the Affordable Care Act did implicitly was by not changing employer-sponsored insurance that much, it was really done around employer-sponsored insurance. Employers said, wait a minute, our costs haven't been controlled. We have to be more active.
Let's go do it, yeah.
And so they said, I need to get a whole bunch of stuff now, whether it's telemedicine or Castoid or bang on my payer to go make a different network and save me money, because they felt that the Affordable Care Act hadn't solved the cost problem. And because they're the ones who pay the high prices and create all the profit in this whole sector, when they start changing how they consume healthcare, the supply side changes. And so I think it's the employers who actually weren't disrupted as much by legislation who now are more disruptive, leading to a lot of the change. And I think they'll keep being disruptive, the employers.
Brandon, you've said that there's never been a more tumultuous time in the healthcare economy, and the disruptive threats to legacy institutions have never been greater. And many of you are investing in very, very forward-thinking, disruptive companies and the like. But speak on what you think legacy institutions need to do to survive, and how is that shaping where you look for investment opportunities and where you look for collaboration, and what does that actually look like between legacy and some of the businesses that you've invested in?
So I certainly acknowledge, the Affordable Care Act was an incredible, if change is our friend, mission accomplished. This certainly cast a huge boulder in our little pond. And yes, every legacy institution is up for grab. Its destiny is up for grabs and is ripe for change. So what I meant in that particular comment you quoted was our largest institutions, like healthcare insurance companies, are vertically integrating forward to become service providers. We had a representative from Optum here today, not from United Healthcare. There's a reason for that. Mark Bertolini at Aetna says that Aetna is going to become a healthcare services company with an insurance subsidiary. Meanwhile, you have big integrated, big hospital systems trying to become payers as fast as they can, learning how to take insurance risk. Bob's got a portfolio company started by Farzad Mostashari, the former Office of National Coordinator head. I've got a similar company that's aimed at taking very large physician groups and organizing them to take risks. So you have the doctor in the equation too, saying, well, what is my role in all of this? So it is a wonderful time to be an investor in this space, perilous as ever, but major disruptions are underway.
I'd like to just make an observation about an incumbent who has done an amazing pivot, I think. Rick Klauser and I were on the board of a company called Audax Health Solutions. Rick was chairman, I was a board member, and we were investors. And we sold it earlier this year to Optum. And the way United Healthcare looked at it—
For a wonderful multiple,
we did well, yeah. And the way that United Healthcare looked at it, they said, gee, the payer world is getting more regulated, but the supplemental health world is being lightly regulated. And as we see something like 370 exchanges being created, pretty bare bones, there's a chance to go sell services to them. And in this pivot towards the consumer era of health, they acquired this small company at the time, Audax Health Solutions, now renamed Rally. And the reason they did was because many people were trying to get consumer engagement, a typical consumer engagement for the majority of the companies working on this. This is over the internet, over wireless carrier devices, would be around 5%. And then re-engagement would drop to maybe 3%. Audax was up at 37% engagement, 31% re-engagement. And most importantly, they had a young CEO, at the time 23 years old, an amazingly talented young team. They were bi-coastal, but their creative work was all being done out in San Francisco. And Optum said, you know, we could reverse engineer this 2 years. We're pretty competent in the technology, but we just know that you'd be 2 years still ahead of us because you've got this young team with a different point of view, the millennials. And so what they have done very successfully is they have taken their strong position in health supplemental services with Optum. Remember, Optum serves the whole industry. And they have been able to basically front end with the Rally consumer engagement engine a lot of the more traditional services they have and create an entirely new line of business with incredibly attractive profit opportunities going forward. So there's an incumbent who was able to pivot, leverage their assets, and remarket them in a way that put them right out in the forefront of the consumer era of healthcare.
So much of the Affordable Care Act is ripe for controversy and juicy discussion. I think it's often overlooked that one of the most significant and highest impact provisions was simply the capping of the medical loss ratio at 85%. If you're a big insurance company, it no longer pays to invest in delivering better care. You would happily, other than if your costs got out of control, you'd lose market share. So if the more services you can offload into that 85%, the happier you are, and the less you have to do it yourself, the simpler life will be. Yeah. And it's causing some very unusual behaviors out there, but it's a subset of that element.
I recall Jack Rowe, who's former CEO of Aetna, told us that when he was at Aetna, that by managing the MLR, the medical loss ratio, just that one metric over a couple of years, and just focused on it, they dropped $2 billion to the bottom line. So the MLR, the medical loss ratio, you say, when you're in consumer marketing, you always try to find one metric, one metric that you can just become obsessive about. And one of the metrics I just love is MLR, medical loss ratio, because it is one of those metrics which a lot of things can be managed into, and yet it's very focused, and it's you're either improving it or you're not.
Well, we're going to have time for questions from all of you in just a few minutes, but as we wrap up this part of the discussion, I just wanted to ask each of you very quickly, what area are you most bullish about for 2015? Where are you placing your biggest bets? And I'd also love to hear you name an opportunity that you've really regretted missing in the past. So I'll start with you, Brandon.
I thought the Audax outcome sounded really good. Sorry. We alluded to it at the top of the discussion when we talked about telemedicine and the importance of integrating telemedicine into the broader continuum of care for individual patients. We've heard a lot today about how patients cope with the vast amount of data that's available. We've talked a lot about innovation and so forth. Jonathan Bush, in his usual peripatetic way, sort of ejaculated this thought about,
That's Jonathan.
channeling Jonathan, about how we need to move beyond the software paradigm to a networked paradigm. And I agree 100%. The top investment theme for me, John, I think you used the word earlier. You said telemedicine needs to be integrated into the broader care. I agree 97% with that comment, except I would change the word to integrative. If the web has taught us anything, it's that we don't need big integrated structures. We need individual high-quality elements that integrate with each other. So my portfolio of the last 12, 18 months, and probably going forward, is chock full of companies that are able to float buoyantly on top of the legacy institutions, but agilely connect with each other, optimally just in time, to provide the kind of continuity of care at a cheap price that has transformed every other industry, like financial services and consumer and manufacturing.
Yeah. Well, the opportunity I missed 5 years ago, Jonathan Bush invited me to go on the Athena Health board when it was a revenue cycle management company and about 300 million market cap, and Brandon was on the board. And I said, no, I don't think I want to be in a public company board. And it's now worth $5 billion. So
the one that got away.
Great success story for Jonathan Bush and Athena Health, and I missed it. But what I think about today is that there are huge opportunities if you think about the customer from a consumer standpoint, but not as a transaction, but think about it as Brandon was just pointing out, that healthcare is really an integrated system, and you've got to think of it systemically. And if you're going to be able to change healthcare, it isn't just about building a cool brand, the way we might have in other industries, but it's about tying the customer solution back so that you get an exceptional, 10x customer experience, and then drive down the price point for delivering that customer experience so it is so clear to everybody, particularly in an era of high deductibles, that this is worth doing. And one of the things that was interesting to me when we were looking at getting into the telehealth business was looking at these walk-in urgent care centers. And we went out and did a survey. And this was about 3 years ago. And we were just totally surprised because we saw that 24% of the population in the United States in our survey, pretty large sample number, had been to a walk-in urgent care center twice in the past year. And at that time, 24% was the amount of penetration of the Apple iPad. And we said, that's pretty impressive. And then we thought about it and said, but can anyone name a national brand of a walk-in urgent care center? It's kind of like your local dry cleaner, Everyone has one, but there isn't any national brand that you think of. And so we said, gee, what a great opportunity to go and build a national brand walk-in urgent care center. And some companies have invested in that, like GA and Sequoia have invested in it, but there hasn't been a big success yet. And my sense is that the evidence that consumers were willing to go out and make a choice, was shown with the walk-in urgent care centers, but we may well see that the next Uber is not the walk-in urgent care centers. It may well be over in this telemedicine space. And it may not be this year or next year. It may be a few years to get there. But I'm absolutely convinced that there's an Uber in here somewhere in this telehealth space. And it's going to be across a highly integrated health delivery system. It isn't just going to be a point product.
Bob, what's the top investment theme for you for 2015? And what's the one that your regret?
So the thing that I'm focusing on is actually helping get patients to the right caregiver. So much of healthcare ends up being, when I practiced, I was an internist. I would see you for anything, and I would see anybody. And I was good at a few things, but not good at most of them. And that's true for all doctors. Whether if you're an oncologist, there's certain types of tumors that you're good at and certain ones that you're not. And same with orthopedists and everything else. And so I'm focused a lot on how do you unbundle the health system network and actually get the right patient with the right demographic characteristics, the right comorbidities to the right doctor who's good at that thing. Because it turns out if you get the patient to the right doctor, the outcomes are a heck of a lot better. And most of healthcare is haphazard, where you end up, and doctors who refer to other doctors don't really know what the referrers are good for in the specifics. They generally know they're good. And so I think there's a huge opportunity to actually do doctor-patient matching to massively improve outcomes and lower cost at the same time, both by avoiding complications, but also you can select doctors at better valued places from a price perspective. And right now, every health network, when you negotiate, the networks, they negotiate like all of New York Presbyterian, not just the good part with the good doctors and, and all of everything, right? And some cardiologists, you want them to, for the valve replacement, but not for the bypass surgery. Well, the plan pays for everything. And so how do you fix that? That's one thing that I'm thinking a lot about. Because at the end of the day, if you look at the spending, it's a small number of patients that really disproportionately account for a high amount of the cost and a high amount of the errors and a high amount of the waste and a high amount of the problem. And so I'm focused a lot on how do you fix that stuff. The other thing that I'm really excited about at the same time is the consumer experience part. It shouldn't, I mean, healthcare, when you buy it, it's probably the most expensive thing you will buy today, this week, this month. And when you buy everything else that's expensive, you're thanked for it, and maybe you get joy from it. And healthcare, we sort of send you a bill later, and it sucks, just the whole experience. And so finding ways to make the experience not just emotionally terrible is something I care about, too. In terms of what I missed, One Medical is one that comes to mind. Tom Lee's built a wonderful, better version of the primary care patient experience. And I think he's done a great job. I wish we invested in that.
Great. Well, with that, I want to open it up to audience questions. Right in the front, Dr. Rothman.
Thanks. That was a great discussion. If I could address this initially to John, because you've have a brilliant track record in addition to your good looks. So what is the characteristics of a great investor in your view? I mean, the novice would say, he's lucky. Bunky Knudsen would push that aside and say, no, the harder I work, the luckier I get. And other friends would say, it's raw intelligence. I compute better than the guy sitting next to me. So is it hard work, intelligence, street judgment? How do you reflect on that now that you're at the midpoint of your career, John?
Well, thank you, Dick. It's nice being at the midpoint of my career. The way I think about it is you have to be able to take the long view in an investment. If you're trying to make a quick return in a year or two, but that's it's too speculative for me to be able to add a lot of value to that. I tend to look at first, what is the world going to maybe look like, not in 10 years, I can't predict that far out, but what might it look like in 4 to 5 years? And I believe that one of the things I learned working with Steve Jobs is what Steve called zooming. And zooming meant that you would zoom out, look at different domains, and then try to connect the dots and come up with something that was a better way of doing something. So the answer that Steve came up back when we worked together was desktop publishing. He loved beautiful fonts. He studied that at Reed College. He and Woz created the first useful personal computer at a price point that was affordable, around $2,000. And then he was invited to Xerox PARC, Palo Alto Research Center, and saw this incredible technology to build very high-end workstations for $60,000 or $70,000. And he connected the dots and said, what if you could take that graphics and ease of use and put it on a $2,000 computer and be able to publish beautiful fonts? So same thing is true in healthcare. And here's what's really hard in healthcare, if you're in the consumer era, that if you go to Silicon Valley, there are a lot of people with great understanding of technology, social media, consumer marketing, but they don't necessarily have the legacy experience of healthcare. Now, I'm not an expert, but I've been in healthcare for about 8 years. I've also been in building big brands for 40 years, and I've been in high tech for 32 years. And so I wouldn't go into healthcare if I didn't have those other domain experiences and to look to try to connect the dots and to try to make an investment decision over 4 to 5 years. Maybe you get lucky as we did with Audax and you get a success earlier than that, but for the most part, it's a 4 or 5 year view of the market. And so I would say an investor doesn't have to be a financial analyst. An investor needs to have domain experience. And if you don't have that multiple domain experience yourself, then get it on your team, or work with someone else in another investment group that has complementary experience with you. But you've got to somewhere in the judgment side of things have multiple domain experience and the ability to connect dots and think out at least 4 or 5 years. If you can't do that, stay away from healthcare. It's too complicated.
A question up there.
Hi, Michael Dermer from WellTalk. We've talked throughout the day about consumerism, and we've made references to the airline industry and car insurance. You kind of walk down the street and you see, Walgreens with 110 million people in their rewards program, and I'm curious about your perspective on the role of financial rewards for consumers for healthy behaviors like you see rewards in other industries. Are we just a little bit away from us having United Healthcare rewards, Cigna rewards, and curious about your perspective on that?
David, what's his name? The guy from who wrote that great Atlantic article, Goldhill, who was here this morning, just had a throwaway comment to the effect that, when's it going to happen that individual patients are rewarded for their healthy behavior in the form of lower premium payments? And I think that simple sentence gets to the heart of what is so tough about healthcare. In that thing you quoted me on earlier, you talking about healthcare being a command economy, that really is the issue. We don't have a market economy in healthcare where buyers and sellers come together, assess the relative value of a service or product, agree on a price, and walk away happy. We have a command economy with a whole set of rules. I love the idea of putting incentives in place. It's pretend capitalism, to be sure. We're sort of kids playing marketplace, but it's a pretty good start. And a bunch of my companies are working with those themes. So I love what you guys are doing with that.
I think we have time for one more question.
Up here. Thanks for the great panel. Just curious what you guys make of the entrance of Apple, Google into this space, especially around wellness and the kind of what we were just talking about a second ago. Things like Fitbits and Apple Health, and where do you see that going? And they're pretty good at taking over entire marketplaces. What do you see happening?
You're from California. You should know the way.
Well, I think, first of all, you have to look at Apple through the perspective of how it's outmaneuvering Samsung really well. Because Apple has been able to start to build vertical platforms on top of its horizontal platform. And they're doing it in the home for home control and smart home. They're doing it for wellness more than healthcare at this point. And they'll probably try to get the sensors in the watch to be able to synchronize with the heavy lifting that'll be done in the iPhone that'll then go up to the cloud. So I suspect that they're going to be a platform, both their vertical platforms and their broader horizontal platforms, for a lot of very creative applications. And I think the same thing will happen with Google. And so I think there'll be a lot going on there. But the problem we've tried to address at a company I founded called Misfit Wearables is that we didn't think people wanted to charge these things every night. So whether it's a watch or a smartphone, if you're going to have something with you all the time, like an activity tracker, by the way, they've all commoditized. I mean, it's basically a commodity industry at this point. So we said, we've got to design one which will have at least 5 to 6 months of battery life on it. And that's what we did. And we had to say, this will be a way to capture data. So we just closed a $40 million round 2 days ago. And we have 140 people. The majority of them are data scientists because we're doing data analytics off of the data that we're capturing off of these devices. And what are we doing as it commoditizes? We're driving the price points way down. So what we were selling for $149 a year ago, we now sell for like $24, and the prices will probably continue to go down in that category. And where do we sell a lot of them? China. and Asia. We're in 51 countries. As we think about these industries that are commoditizing, you have to look at the world, because Apple and Google are world brands, and you have to look at what people want to do in different parts of the world. And my sense is that in the Internet of Things era, that sensors, it's all about sensors, all about machine to machine, machine learning, sensors getting smaller and smaller, cheaper and cheaper. But we're just at the beginning of these things. And Apple and Google are high-profile examples, but it's going to go way beyond what Apple is doing and what Google is doing. And I suspect that we're going to see entire industries completely reinvented through either what's called the digitization of work, where you can reinvent the whole work processes and workflows of healthcare, and at the same time, change the ways in which we can capture data from consumers in the ways that were discussed in previous panels today.
Great. Well, Brandon, Bob, John, thank you so much for your insights today. Much appreciated.
Thanks for having us.
And hopefully next year we can come back and talk about how these bets have paid off. And
Oh, we'll be retired by then.
of course. Well, thank you.
Thank you.